All right, so the question is, how long does it take for hemodialysis to start and finish? From the moment you walk in that door to the moment you leave, how long would I be there? So the total time for hemodialysis depends on many different things. One, check-in and preparation. Two, your prescribed treatment time. And three, post-treatment assessment. So check-in and preparation basically means when you walk into that lobby, you ring the doorbell and they bring you onto the treatment floor. What are they doing? They're giving you a mask. They're checking your temperature. They're telling you to take your purse down, take off that jacket, take off your shoes, take off all the excess weight, keys out of your pocket, and get on the scale so we can see what your actual weight is. Once they get your actual weight, they're going to bring you to your treatment chair. You're going to put your pillow down, put your blanket down, put your book down, blah, blah, blah. You're going to get all comfortable. They're going to put that blood pressure cuff on your arm, take your vitals while you're standing, and take your vitals while you're sitting. So after they take your 2 vitals, hopefully everything's okay. If everything's okay, you're going to sit down. They're going to put all the data into the machine, which will take a few minutes. Once it's in the machine, they'll tell you how much fluid they're taking off your body, and then they'll be ready to assess you. So at this point, it is different if you have a CVC, which is a catheter that goes to your heart, or if you actually have a fistula or a graft in your arm. If you have a CVC, they'll take off that dressing, they'll look at the site, they'll assess it, make sure there's no infection, make sure everything's good. They'll clean that site up real good and re-bandage it. After they re-bandage it, they'll clean your access ports. They'll, at this point, they'll take a blood sample if they need a blood sample, and then they'll connect you. If you have a fistula or a graft, they'll look at your fistula or graft, they'll listen to it, they'll feel it, make sure it's functioning properly. Then they'll take these 2 big needles, they'll put them in, make sure they're flowing right, they'll tape it down, they'll take a blood sample if they need to, and then they'll connect you to the machine and say we're good to go. This whole process takes about 15 to 30 minutes. I would say just say 30 minutes, just that extra wiggle room, just make sure you have it. If you're planning on getting a ride to pick you up, this process takes 30 minutes, let's just say that. So after this, it's all about your treatment now. So they're gonna connect you to the machine, they're gonna start your treatment. So let's say your treatment is 3 hours. Why is it 3 hours? Why isn't it 4.5 hours? Why isn't it 5 hours? It all depends on your doctor, and the doctor's gonna look at your level of kidney function. If you have what's called a residual kidney function, meaning your kidneys are still working a little bit, you're still urinating, getting rid of toxins, getting rid of fluids, your time will be lower because your kidneys are still functioning to an extent. So the amount of waste or urea that's built up in your body, the amount of fluids that's built up in your body will help determine how long you're gonna be on that treatment. If you're a larger individual, you're gonna be on longer than a smaller individual. If you have a CVC, the port that goes to your heart, it doesn't pull as fast as it would if you had a fistula or a graft. Now, it does clean your blood pretty fast, but if you have a fistula or a graft, it can actually go faster than if you have a CVC. How's your health? How's your blood pressure? Is it really, really high? Is it really, really low? Do you have congestive heart failure? Do you have a history of heart attacks? Because if you do, then the treatments will have to be easier on you. We'll have to do it a little bit slower. So maybe instead of doing it 2 days a week, you'll do it 3 days a week. How much fluid did you put on your body? You're supposed to weigh 100 kilograms, but you partied over the weekend, now you weigh 110 kilograms. You're supposed to be doing this 3 days a week, but now you're gonna do it 4 days a week because you have all that extra fluid on you. So there's many things that can affect your treatment time and how many days or hours that you do dialysis. And all of this is to ensure that all the toxins and fluids are being removed from your body so you can be a happy, healthy patient. So let's pretend my treatment time is 3 hours. Pre-treatment is 30 minutes, so that's 3 hours and 30 minutes. Now what about post-treatment? How long does that take? So I say that takes also another 15 to 30 minutes because after the treatment, they'll return your blood to you. They may take another post-treatment blood sample, and they're gonna look for different side effects that you may be experiencing. So a lot of people, not a lot of people, but some people are dizzy, or cramping, or fatigued after dialysis. They're nauseous. So you need to watch them. Stay in the chair for a little bit, put your feet up. Let me check your blood pressure is a little low. Let me make sure you're okay before you get out of here. Or, hey, it looks like you just had a seizure. Do I need to call 911, et cetera, et cetera. How's your blood pressure? Is your blood pressure good? Is your blood pressure bad? Sit here, relax for a little bit, maybe take some medication. If you have a fistula, when they pull those needles out, you're going to bleed, right? Those needles, 2 needles are just in your arm. So they have to hold those sites down. How long does it take for your blood to clot? Is it 5 minutes per site? Because you have 2 needles, so it's 2 sites. If it is, great. but is it taking 10 minutes for your blood to clot? Do we have to put special clamps on it to help hold it while we walk off and do something else, because we have other things that we have to do as well? While the clamp is there, it's making sure that you don't bleed. Sometimes it takes people 15 minutes to clot after they get that fistula needle taken out. So all of this can add to the time that you're sitting there. Even recovering from the fatigue or dizziness, just sitting there drinking some water, that all takes time. Do you need medication? Do you need to talk to the dietitian? Does a nurse need to educate you? Does a social worker need to talk to you about some stuff? Why didn't they talk to me about this stuff during my treatment? Oh, I'm so sorry, I was busy, but I have to talk to you before you go. You have to sign this before you go. You need this extra education, blah, blah, blah. So I say add 30 minutes to your post-dialysis assessment. So if you're supposed to have a 3-hour treatment, 30 minutes pre-assessment, 30 minutes post-assessment, just round up an extra hour. So if your treatment's 4 hours, say you'll be there for 5 hours. If your treatment's 4.5 hours, say you'll be there for 5.5 hours. That's the easiest thing to do to make sure that you're not running around having family members waiting for you when you say that you're only supposed to be there for 3 hours, but you end up being there for 4 hours. Hope that helps. Hope that answers your question. Take care. Ciao.